What has happened to freedom in the last year in the context of the COVID-19 pandemic? Join me in this week's Libertarian Angle as I examine that question. I'm Jacob Hornberger, president of the Future of Freedom Foundation, and this is this week's Libertarian Angle, the show, as y'all know, that brings you the principled, uncompromising case for the free society. I'm talking to you from a hotel in Denton, Texas, where I am right now. And if you're new to the Future of Freedom Foundation, this is your first exposure, I would invite you to come and visit our website at fff.org. Subscribe to our FFF Daily, which we strive to make the best daily libertarian commentary page on the internet, and also to our monthly journal, Future of Freedom. What we do at FFF is we present the principled case for liberty in the context of the burning issues of the day. And obviously, one of the biggest burning issues of the day is this pandemic that we've now lived under for more than a year now. And I want to talk to you about this whole crisis environment and all the things that have gone on and the battles that especially that conservatives and libertarian-leaning conservatives and conservative-leaning libertarians have waged against what the government is doing. Because I think it's important that we put things in a context. I look back at this whole year and I see it as a total waste for liberty. Just total waste. It didn't accomplish anything with respect to freedom. Now, why do I say that? Well, it's not just because of the mandates, the lockdowns, the mask mandates, and so forth. It's because there has been absolutely no focus on what a free society is. Now, those of you that are familiar with my work, especially in the last few years, know that I draw an important line as to what freedom is as compared to reforming the welfare warfare state. Now, that's the kind of system that we've all been born and raised under, a welfare warfare state way of life. The welfare state way of life came into existence in the 1930s. It was introduced through its crown jewel, Social Security, a socialist program that originated among German socialists in the late 1800s and was then later imported into the United States. But that was the watershed period with respect to the welfare state. The idea was that government came to represent a means by which force would be used to take money from people who had it in order to give it to people who the government felt needed it more. And then you've got the warfare state, or the national security state. President Eisenhower called it the military-industrial complex. People today call it the deep state. What I'm referring to is the vast military establishment represented by the Pentagon, the Joint Chiefs of Staff, an empire of military bases, both domestic and foreign, the CIA, the NSA, and to a certain extent the FBI as well. And that came into existence after World War II. Now, the FBI had preceded that, but after the national security state came into existence, the FBI became a de facto member of it. And so what I've been arguing about for the past several years is that if all we do and all we accomplish is reforming this way of life, we haven't achieved freedom. Because this way of life, the welfare warfare state, is antithetical to freedom. So what we need to do to achieve freedom is dismantle it. And the reason for this is that if you want a free society, you have to identify what the infringements are that are preventing you from being free. Now, why is that important? Well, because in order to achieve freedom, you've got to remove infringements. Now, let's assume you've got 100 infringements on freedom that the government's put on you at all levels of government. Well, if all you do is reform these infringements, fix them, make them better, make them more efficient, you might at best have improved a lot of people, improved their lives, but you will not have achieved freedom, because freedom entails a removal of the infringement. So you remove the 100th and then the 99th and then the 98th and the 97th, and then you proceed all the way down to where you got 3 or 4 left, and you concentrate on removing those. The analogy that I often use, as my longtime readers and viewers know, is slavery. That if all we did, if all people did with respect to slavery is reform it, like pass a law with fewer lashings and better work conditions, shorter work hours for the slaves, that would improve their lives, no doubt about it. And perhaps they'd even been grateful for that, but they would have known it wasn't freedom. Freedom entails a dismantling of the structure of slavery, the very institution of slavery. Then when you dismantle that massive infringement on freedom, then you're talking about real freedom as compared to just reforming the infringement. Well, it's the same thing here. We live essentially lives of serfs. It's not like slavery in a certain sense it is, but I think it's more akin to serfdom, where we serve the state. We serve the welfare state. We toil, we work, but it's all with the idea that we're going to send them a portion of our income so that they can use this to sustain their operations. And they set the percentage. I mean, sometimes they're nice and they set the percentage low. Sometimes they're not so nice and they set the percentage high. Sometimes they simply take from us through debasement of the currency, which is what they're doing now. But the idea as a serf is that you exist to serve them, that you're an instrument by which they're able to sustain their operations. So they like it. The harder you work and the more money you make, they love it, because that means a bigger percentage is going into their coffers. So that's the kind of life we live under. Now let's talk about healthcare. We've got an important thing to keep in mind here, that before the coronavirus thing hit, which was around January or February of last year, there was already a healthcare crisis. Okay, we tend to forget that in the midst of this big pandemic crisis, that there was already a healthcare crisis, a major crisis. It was a crisis to such an extent where Obamacare had to be enacted, and then almost immediately after Obamacare was enacted, the liberals, the progressives, the socialists, they all began advocating for just full government health care, like Medicare for all. That's what they call it, Medicare for all. Well, that was just an implicit acknowledgement that Obamacare was just a step in that direction. It was never a solution. It was just going to be a step in that direction. They knew it was going to fail, and so they were already prepared to say, well, okay, we've tried everything. We've tried Obamacare. The only thing left is to go to full-fledged socialism, socialized healthcare. So healthcare costs were soaring. Of course, they still are. You've got doctors that are totally disgusted. Before the pandemic, they were retiring early. The government was going after a lot of them on Medicare fraud and so forth. I mean, the whole system was in crisis. All right, so you had groups of conservatives as well as conservative-leaning libertarians that were faced with a choice here. Is what do we do about this crisis? And unfortunately, these groups of people moved in the direction of reform. Now, let's go over to what the real solution is first before we analyze their systems for reform. The real solution is an abolition of the root cause of the problem. In other words, a dismantling of the infringement. The infringement is Medicare and Medicaid, these two socialist programs that came into existence under President Lyndon Johnson, who, of course, was a protege of Franklin Roosevelt. So what Johnson was doing was trying to build on what Roosevelt did with Social Security and saying, oh, well, I want to be a good person. I want government to be good. I wanted to provide health care for the elderly and the poor. Well, this succeeded in destroying the finest healthcare system in history. America had the finest healthcare system in history. When I grew up in the 1950s, before the Medicare and Medicaid were adopted, hardly anyone had healthcare insurance, major medical insurance. I mean, some people bought catastrophic in case they got cancer or something like that. But for regular medical expenses, nobody had insurance. And the reason for that was because healthcare costs were so low. It was like going to the grocery store. And people just paid when they went to the doctors. It was just considered an ordinary expense, like going to the grocery store. I mean, how many people have grocery store insurance to protect against the soaring costs of groceries? Well, they might now with the Federal Reserve debasing the currency. Food prices are soaring, as I'm sure most of y'all know. But Back then, going to the doctors was just a regular expense, and people built it into their regular income and their daily expenses. Uh, the poor were being handled by doctors that were handling the cases for free. I grew up on the border, U.S.-Mexico border in Laredo, Texas. It was the poorest city in the United States, according to the Census Bureau. Every day, doctors' offices were filled with people, filled, most of whom every doctor knew could not pay. Many of them were coming over from Nuevo Laredo, Mexico. And there was never a case, as far as I know, of any doctor turning away any patient. And sometimes they would bring like chickens, to give to the doctor, or enchiladas, or plate of enchiladas, or some tacos, or something like that, as a way to say thank you. But the doctors didn't care. I mean, it was just as their part of their moral duty, their ethical duty, they felt, and they enjoyed what they were doing, and they were still making a lot of money. They were the second wealthiest people in town, second only to the oil people. That's because they were making money off the people who were paying. So they sort of felt, well, this is a way to pay back all, a nice lifestyle, a nice home, swimming pools, and so forth. And so the needs of the poor were being handled. And so Johnson comes in with this massive government program, a socialist program that also had originated among socialists in Germany, and it put a massive demand onto the system. Artificial demand, government demand. That's when healthcare costs started soaring. That's the cause of the soaring healthcare costs. That's the cause of the crisis. And you see, the socialists don't want to acknowledge that. They say, oh, no, the cause is free enterprise. Just as what Roosevelt, remember when Roosevelt had the Great Depression? What did they blame it on? The failure of free enterprise, right? We hear that in public schools. The Great Depression showed the failure of free enterprise. It was all nonsense. It was the failure of monetary central planning by the Federal Reserve, which had come into existence in 1913. Americans had lived without a Federal Reserve system for more than a century. And so this is what they were saying is that the cost of these soaring healthcare costs, the cost of this ever-increasing healthcare crisis in America, where people were now starting to get insurance, having to buy insurance, okay? Because now they really needed to protect themselves against the prospect of bankruptcy if they got sick. So the socialists, the progressives, whatever, would not acknowledge that Medicare and Medicaid were the cause of the problem. It was, those rapacious insurance companies. They're the ones, look at, they're charging the premiums they're charging. And it's the failure of free enterprise again, and we need more government intervention. So that's how you get Obamacare, because you already had this major crisis. But rather than get rid of the root cause of the crisis, which was the only real solution, especially with respect to liberty, they progressively go on into more and more socialism. Now, enter the conservatives, as well as many of the conservative-leaning libertarians. The conservatives long ago, during the race between Lyndon Johnson and Barry Goldwater for president, the conservatives got smashed. Now, Goldwater had taken a fairly principled approach to the welfare state, opposing things like Social Security and Medicare and Medicaid, which conservatives did in the 1930s. And they fought fiercely against this shift over to the welfare state way of life. But after Goldwater got smashed in the 1964 election, I think he carried like one or two states or something like that, but it was a landslide for Lyndon Johnson. The conservatives had some soul searching to do, and they said, well, if we're going to be a player in this system, get our op-eds published among the think tanks and the educational foundations, and if the mainstream press is going to take us seriously, and if we're going to be elected to office, we have to just throw in the towel and accept that the welfare state's here. And we just need to just accept that Social Security is here as a permanent thing, Medicare, Medicaid, and then let's just work around it and come up with our own reform packages under the guise of advancing freedom. So they maintained their mantras, their favorite one being free enterprise, private property, and limited government. Okay, but you had none of those now. With the welfare state, you had none of those three elements of the mantra that conservatives love. And so they said, but if we come up with reforms, we can kind of delude ourselves and delude others into saying, we're advancing freedom, we're better than those liberals. And one of the most popular of these reforms, which is still popular, is health savings accounts. I mean, you see, this is a major conservative reform. It's a major reform advocated by conservative leaning libertarians. The idea is that since we have this system and it's in crisis, the way to really manage this thing and make it better and improve it is through health savings accounts. Let people put their money into savings accounts, and then they'll be able to manage their own expenses. And it's all this kind of like Rube Goldberg type schemes to make it look like they're advancing freedom. And sure enough, conservatives will tell you, oh, we're advancing freedom, Jacob. We're advancing freedom. But they're doing nothing of the sort. What they're advancing is reform. And reform is not freedom, because remember, freedom is a removal of the infringement on freedom. It's not a reform of the infringement. So with respect to health care, you have to get rid of Medicare and Medicaid. But remember, conservatives, as well as conservative leaning libertarians, they're not going to go down that road. They've accepted the premises of the welfare state. They will seal their lips when it comes to Medicare and Medicaid, or even worse, they'll say, I believe in it. I think it's a good program, or these are good programs, and that we need to just get health savings accounts and voila, the crisis will be over. Well, it's not going to be over. I don't care if health savings accounts were adopted on the federal level, state level, local level. You would continue to have a healthcare crisis, which means that the socialists will progressively get us more and more toward full socialized healthcare, like in Cuba or Venezuela. Again, if you want freedom, you have to remove the infringement. You got to go to the root. You got to identify what that infringement is, which means getting rid of Medicare and Medicaid. Now, there was another aspect. So you've got this socialist program in healthcare where the government takes money from one group of people and gives it to another group of people in terms of healthcare. This is for the elderly and the poor. And the government portrays itself as a really good entity. It's helping the poor and the needy and the disadvantaged. But in actuality, it's destroying the greatest healthcare system in history, as well as destroying freedom. Now, that's one aspect of America's healthcare system. The other aspect we never really saw much of. I mean, we knew it was there, but we really didn't see its application in a really direct, tyrannical sense until this pandemic. And then, boy, it just surfaced like it was like this monster that was like underneath the surface of the water. And then all of a sudden the water dries up a little bit and you see the outline of this monster, and then it rises up. And you now realize, wow, there's another major aspect to this healthcare system that America has. And that aspect is a central planning system. So you've got over here central planning, which is a socialist construct. And over here, you've got this socialist system that's taking money from one group of people and giving it to another group of people through Medicare and Medicaid. Well, what is central planning? Well, central planning is where the government board of commissars, bureaucrats, whatever, is planning a peaceful activity through the force of government. And it's directing and managing the activities of, let's say, millions of people. And what this produces is always what Ludwig von Mises called planned chaos, the chaos that comes from central planning. And this is what helped bring down the Soviet Union, that their whole system was based on central planning. So you have this total system of chaos, long lines, directives, mandates, scarcity, shortages. It just, like I say, total chaos. And that's what central planning produces. So you have this system of central planning with respect to healthcare that's represented by the Centers for Disease Control and the FDA and the President's Task Force on healthcare. You know, all these entities are combining to form this framework for healthcare central planning. And like I say, you don't see, I mean, we hear, the FDA with, years and years before they approve a medication that could be saving lives and stuff. Everybody's got to go through the FDA to get their drugs approved and so forth. We've heard about that, but we really didn't see the impact of this central planning system till this pandemic hit. And then, boy, did we see it. I mean, immediately, the Centers for Disease Control with Anthony Fauci, they start recommending lockdowns and mask mandates and all sorts of things. You saw chaos in the beginning days where you don't need a mask. Yes, you do need a mask. Well, a mask will help you. No, it won't help you. And then you couldn't get a mask Remember, there were shortages of masks, and there were shortages of ventilators, and there were shortages of hand sanitizers. I mean, you planned chaos. You couldn't find a better term to describe what was going on there in the early days. And then the conservatives and the conservative-leaning libertarians enter the picture. And they start battling against these lockdowns and saying that this is not what freedom's about. Freedom's about no lockdowns here. And they pointed to the massive economic damage that was being done by the government by essentially saying you need to shut down or you need to require masks at a certain point of everybody. And of course, a lot of this was being done at the state level through the guidance of the federal officials as to what needed to be done. So you had this massive lockdown where people were put out of jobs and people were put out of business. I mean, some of these businesses, as we know, will never recover. There's bankruptcies. And then of course, on top of this, you've got President Trump over there waging trade wars against China and embargoes. And so it's like, just slamming down people that were already being slammed down. But through it all, the conservatives were arguing that this is not what freedom's about. Freedom's about no mandates. Fauci should leave these businesses alone. Let them decide what's going on, how they should run their businesses, and the government should not be doing mask mandates and requiring people to wear masks and so forth. And freedom means not having to wear masks. But you see, this is where it's been a wasted year, because this is what conservatives just don't realize, that that's not what freedom's all about. We've spent an entire year of listening to conservatives talk about, we're advancing freedom, we're opposing Fauci's lockdowns, and now we've got his emails, and boy, we're going to disclose that there was cover-ups here, and man, we're advancing freedom. No, you're not. No, you're not. All you're doing is advancing reform. That what they're really saying is that we don't approve of the job Fauci is doing. We don't like his central plan. We don't like his management of this crisis. If only we had a libertarian-leaning conservative up there instead of Fauci, then we'd have a much better, plan for freedom. And in other words, it's central planning for freedom. And this is what the conservatives just don't get. That it has never been a simple problem of stopping the mask mandates and stopping the businesses stopping the lockdown and the businesses and stopping all these mandates. That's not what freedom's about. Any more than freedom is about, in the 19th century, shorter work hours for slaves and better work conditions for slaves. Freedom entails much more than that. That what conservatives have been fighting for the last year is reform. I mean, what their lament is that the government's not adopting the central plan that they want. But they have no problems with central planning, because notice that they have never, as far as I know, I have not seen one op-ed, one commentary, and if there has been one, it's very rare. They don't argue for the abolition of the Centers for Disease Control and the FDA and the President's Task Force on Healthcare, whatever it's called. I never hear them calling for the abolition of these programs. And why is that? Because they believe in central planning. Conservatives believe in healthcare central planning. That's why I say is that they threw in the towel after the Goldwater debacle. They said we have to just, if we're going to be a player, if we're going to get elected to public office, if Americans are going to support us, if the editorial boards are going to accept our op-eds and our editorials, we have to play the game. We have to just throw in the towel, accept that not only that Medicare and Medicaid are here as a permanent thing, we can never call for their abolition, we have to remain quiet on that, but it's the same with central planning. Never question the central planning paradigm. Just question how they're running the central planning paradigm. And that's all we've seen for a year, is that Fauci should have never ordered or recommended lockdowns. He should have instead left each business free to make these decisions, and they should have never have done the mask mandates. Let people decide for themselves how to do this, and they couch it in terms of freedom. Freedom entails running your business the way you want, all of which is right. But the way they present it is in the context of their disagreement with the central plan. In other words, they have no objection to the government centrally planning healthcare, just like they don't have any objection to Medicare and Medicaid. They just want the central plan to be in accordance with what they think is the best thing to do. And so let's assume that the central planners at the federal and the state level, we see this at the state level too, the state boards of education and the governors exercising these tyrannical powers dealing with healthcare. Let's assume that their plan had been let every business make its own decision. And then there was this, let's just assume hypothetically that there was this massive death toll and massive infection toll. Well, then you'd have the people saying, this is outrageous. They're mismanaging the pandemic. We can't believe that they let businesses free to do this. So you'd have the chaos in a different direction. But again, all the focus would be on what the government's doing as part of its central plan. So what is the real freedom approach? And this is why I say that this year's been sort of a waste. The real freedom approach is get rid of the central planning. In other words, separate healthcare in the state entirely. There's no other solution with respect to freedom. Because remember, freedom entails identifying the infringements on freedom and then removing them. If all we do is come up with a better central plan for Fauci to follow, we have done nothing for freedom. What we need to do is raise people's vision to a higher level. And that is, get rid of central planning, healthcare central planning. Look at how our ancestors handle things with respect to religion. If they had not separated church and state, religion and the state, today it would be total chaos. The government would be running or controlling or managing the churches, the synagogues, the mosques. There'd be fights, like political battles. I mean, the whole thing would be planned chaos in the religious sphere. So what they said is, we're not even going to go down there. We're not going to argue over which plan the government should adopt with respect to how the churches and religious institutions should operate. We're going to just say, government has no role in religion at all, period. You see, now you're talking about freedom, because the government now cannot do anything with respect to religion. Well, it's the same thing with healthcare. Government has no more business in healthcare than it does in religion. What does government know about healthcare? It's the healthcare industry that knows about healthcare. So if you'd had a free market healthcare system, that is one with no Medicare, no Medicaid, no occupational licensure laws that limit supply, Milton Friedman talked about that in his great book, Capitalism and Freedom, and no central planning. Now, when a natural disaster hits, let's say it's a pandemic, then we look to the healthcare industry for guidance. And some of them would say, hey, look, we recommend that businesses require people to wear masks that come in there. Businesses would then make the choice of what kind of policy to establish. Consumers would make their choices. I don't want to go into a restaurant that doesn't require everyone to wear masks, okay? So you boycott that restaurant, or you go into another one that shares your philosophy. But then you've got the healthcare industry, which knows about the healthcare much more than the government does, guiding us out of this healthcare crisis. And at the same time, preserving freedom. Because now you've got, like in religion, a separation of healthcare in the state. So that at both the federal and the state level, I mean, you could have a constitutional amendment that says neither the federal government nor the state government shall enact any law providing for healthcare, the furnishing of healthcare, or the regulation of healthcare, or abridging the exercise of healthcare. Now you're talking about real freedom. And in order to do that, in order to achieve that, you've got to make the case for freedom. For people to think about something, they have to hear it. And so if all we do is just be like conservatives, and we just call for reform, and we say, hey, look, this is free market, this is reform, that we get Fauci to do our central plan, then no one starts thinking about what real freedom is. And real freedom is a separation of healthcare in the state. So we have to make that case for people to then start considering it, because that's the only chance there is that you then reach a critical mass of people that say, we want a separation of healthcare in the state. Same way that happened with respect to a separation of church and state in the First Amendment. They had reached a critical number of people in society that said, that's the way to go. That's the free society. separate church and state. And it's the same thing with respect to healthcare, that we have the potential of leading America and the world out of the socialist crisis. And in order to do that, we have to make the case not just for reforming socialism, as conservatives do. We have to make the case for genuine freedom. And that's a much tougher task, obviously. I mean, persuading people that healthcare freedom requires the dismantling of these socialist programs, Medicare and Medicaid, and these central planning programs, Centers for Disease Control and so forth. That's a tougher task, but it's one that we have to pursue if we're going to achieve the free society, because again, freedom entails a removal of infringements on freedom rather than their reform. That's my presentation for Libertarian Angle this week, and thank you very much for tuning in. Thanks for your great support, and I'll see you next week.